We all have different experiences and perspectives in PPC, but I bet there's something that you and I will definitely agree on. We trust the ad platforms less today than we used to. Less transparency, less control, privacy regulations, data thresholds. This stuff is getting harder. Let's talk about it. This is PPC Zone, December 2024 in PPC We Trust. I'm your host, Jill Saskin-Gales. I use the pronouns she and her. I'm a Google Ads coach, ex-Googler, and the founder of Inside Google Ads. I created PPC Zone in 2022 to elevate new perspectives and insights in our industry. PPC Zone is exclusively sponsored by Optimizer, one of the leading automation PPC management suites to help you run your Google, Microsoft, Amazon, and paid social ads. Thanks to Optimizer, I can continue to bring you this live global event for free each month so we can continue to elevate new perspectives in our industry. If you want to use industry-leading tools like the PPC Investigator or Campaign Automator, start your free full functionality trial at optimizer.com. That's OPTMYZR.com. First up in the zone is the founder of True Pano Consulting. Hailing from Wichita, Kansas, she has been working in healthcare marketing for a decade. Having built and ran hundreds of Google and Meta ads, she is an expert in virtually every healthcare service line campaign. Today, she's here to tell us about Google Ads in the healthcare vertical. Please welcome Abby Nelson.
Thanks so much, Jill. We'll get right into it. So I'm covering Google Ads in the healthcare vertical, which is my specialty. So we're going to start off with one of the major things that I walk my clients through, which is patient acquisition. So we utilize Google Ads in order to get patients through the door for their hospital and healthcare systems. So a few things that we do know: 77% of patients are searching for their healthcare providers online. So I work with a lot of healthcare and hospital systems, and I recommend to them to leverage localized Google Ads campaigns that are capturing those high intent searchers at the point of need where they are scheduling appointments. So I do want to cover some challenges that we're aware of in the healthcare industry. So this is a very strict regulatory environment that we are dealing with when we're talking about advertising. We also know that there's a lot of intense competition for high value keywords for certain service lines, and that can drive up costs for Google search ads. We also know that patients have very diverse needs. It's things like immediate care needs, routine checkups, as well as very precise treatments that they are needing as well. Google Ads offers a direct path to connect those patients at the point of search with the providers, where they're actively seeking out specific procedures, types of treatments, and healthcare providers. So we do know that effective campaigns can help bridge that gap between patient needs and their healthcare services that they're trying to get. So from a lot of trial and error, I want to highlight what does work and avoid what doesn't work. So there's some things that we definitely want to utilize with Google Ads that we know work. So we can do the patient acquisition campaigns through highly targeted search campaigns. We utilize those responsive search ads and we adapt them based on the search queries that we know are coming through and the keywords that best meet their needs. We utilize very tight keyword lists. This just helps us reduce those costs, and we're really focused on the specific providers and treatments that we know that these patients needs. There are things that we simply cannot do for healthcare campaigns. So we can't utilize any remarketing campaigns. This is restricted in not only in Google Ads, but overall in the healthcare vertical. It's ethically not responsible to use remarketing campaigns. We can't use shopping ads because obviously patients aren't necessarily shopping for any healthcare providers. And then we do not utilize dynamic search ads simply because there's a lot of compliance issues that these healthcare systems have to deal with. And then we don't use calls from ads within Google Ads just because we have some concerns about how Google would utilize that data. So the big things here are making sure that I'm running, HIPAA compliant campaigns. I'd also recommend that we add in a layer of additional secure conversion tracking. There's a lot of different vendors out there that utilize that, and it just helps encrypt any, protective health information that would come through from, form fills or calls. And then I also recommend using a separate secure call tracking system so that we're able to capture those calls as well. So the big thing that I always try and get across with my clients is the cost per acquisition. I'm sure you all are well aware of that. So we do see much higher cost per acquisitions in a lot of healthcare campaigns that we run. There's a variety of reasons. So we have, the strict regulatory requirements, the high competition for keywords. We do see some lower CPAs for service lines like urgent care and primary care from that $30 to $100 range. But for very specialized service lines, it's not uncommon to see cost per acquisitions between $300 to over $1,000. Reasons being, we've got a very niche audience. They have very specific medical needs. It's also a very long decision-making journey. For instance, if I'm shopping for shoes online, I might make that decision within minutes to an hour. Whereas these patients are making very complex medical decisions that it takes them days, weeks, months to decide on a provider or treatment plan. And then, for that $1,000 CPA for a service line such as oncology, cancer treatment, that's justifiable because we have a longer potential lifetime revenue that can be higher for those types of treatments. So it's understandable for those. And then we also have some considerations regarding the geographics. So urban areas, we're going to see a lot more competition. So higher CPAs are also expected there. I always use the scenario of Kansas versus Miami. $1,000 gets you a lot more spend in Kansas versus Miami. So you're going to expect to see higher CPAs. And how we mitigate that is, a lot of times for those very densely populated areas, we recommend, reducing that geo-targeting 15 to 20 miles, whereas in very rural areas, you could have a 100-mile radius. But what I've always talked to my clients about, it's essential to view that cost per acquisition as a broader patient acquisition strategy that also meets their immediate and long-term needs. So the winning strategies, best practices, and I'm sure a lot of these are very familiar to you all. We utilize a lot of extensive negative keyword lists. Google does not know healthcare very well. So unfortunately, they view an orthopedic surgeon and a podiatrist as essentially the same thing. So we have to very carefully monitor what keywords we have or searches that we have coming in and add those to extensive negative keyword lists. Obviously, calls to action is going to be a very big thing here. We want people scheduling appointments, optimizing those landing pages for speed and clarity and ensuring that they're mobile friendly. As we know, majority of searches are coming through on mobile now. Clear, compelling ad copy is key. If the ad mentions same-day appointments, this should also be reflected in the landing page. And then speaking directly to those patient needs and avoiding any clinical terms. Simply said, patients don't know the clinical terms. It really needs to be simple and approachable in the ad copy. And then the biggest point here is just ensuring that we're tracking everything from calls, form submissions, appointment bookings in order to measure ad performance accurately and optimize for that lowest point of conversion. But in summary, Google Ads, I know this from running hundreds, if not thousands of healthcare ads, are effective in attracting and converting patients, and just ensuring that clear messaging and a seamless user experience is going to be really key in driving measurable results. Thank you all, and let me know if you have any questions in the healthcare vertical.
Thank you so much, Abby, for sharing your unique perspective and insights with us in the zone. If you'd like to connect with Abby Nelson, you can find her on LinkedIn. And if you would like to apply to speak at an upcoming PPC Zone event, you can do so on our website at ppc.zone. I'm your host, Jill Saskin-Gales. You can follow me on LinkedIn to stay up to date on future events. Thank you one more time to Optimizer, our exclusive sponsor, for supporting our mission to elevate new perspectives and insights in our industry. I look forward to seeing you next time in the zone.